Hi guys, so what we're going to talk about today is albuterol and what it does, how to use it, the pharmacodynamics, side effects, dosage, special instructions that there may be, and at the end there is a quick summary quiz. Okay, so what albuterol is an androgenic medication that stimulates the beta-2 androgenic receptors in the smooth muscles of your bronchi and bronchioles, which I actually have a little diagram thing. So these are your bronchi, these like large things, and then the bronchioles are the smaller ones. And what happens whenever you're having anxiety attack or not anxiety, asthma attack, is those bronchioles and bronchi and bronchioles will be like they'll like constrict like this straw. And what albuterol does is it dilates them, and so you can breathe through them. You can't see through the straw, but so you can breathe through them. This is very helpful in situations when you feel like you can't breathe, and this can be used like as a preventative treatment or a full treatment. Albuterol can also be called Proventil HFA, Ventolin HFA, ProAir Respiclic, Aramir, Aposalvin AM, and Ventolin HFA.
Albuterol can come in powder, suspension, solution, tablets, aerosol powder, or solution. You can find any of these in a nebulizer or an inhaler. The tablets come in little circles, and there is rapid acting and long acting medication. If you take this drug orally, the onset will be in 15 to 30 minutes. It'll peak in about 2 to 3 hours and it lasts 8 to 12 hours. If you inhale albuterol, it'll be 5 to 15 minute onset, a 1 to 1.5 hour peak, and a 3 to 6 hour duration. This drug is metabolized by the liver. Dosage of albuterol depend on age and weight. Aerosol medications come in a 90 microgram acquisition, like aerosol can, and it looks like this. If it focuses. This can be put into an inhaler that looks like this, and you just stick it in there, and it'll come on the back of it 200 doses. Each dose is about 180 micrograms, and so you take 2 puffs of this inhaler. You have to shake it really well, which I'm not going to do because I'm not actually taking it, but you just take the cap off, you shake it, and then you puff it twice into your inhaler. You suck in for 10 seconds, and you can do that every 4 to 6 hours or as needed. If you're going to take this for exercise-induced asthma, then you take 2 puffs like I just indicated, and you can do that 5 minutes before exercising. When using aerosols in children under the age of 4 years old, you give them 4 to 8 puffs every 20 minutes for 3 doses, and then every 4 to 8 puffs every 1 to 4 hours. In adolescents, you take 4 to 8 puffs every 20 minutes for 4 hours, and then you take 4 to 8 puffs every 1 to 4 hours, and that is again with the inhaler that I just showed you. When using a nebulizer in adults, you use 2.5 milligrams 3 to 4 times daily, and that will be in a 2.5 milliliter sterile saline over 5 to 15 minutes. And in children under the age of 12 years old, it's the same, or over the age of 12 years old, it's the same as adults. 2 to 12 years old, you use 1 to 5 milligrams per kilogram every 20 minutes for 3 doses, and then after that you would use 0.15 to 0.3 milligrams per kilograms every 1.4 hours. You should only have a maximum of 10 milligrams every day. When administering regular tablets to an adult, they should be 2 to 4 milligrams each, given to them by mouth, like orally, 3 to 4 times a day. And if they're extended release tablets, they should be between 4 and 8 milligrams, taken by mouth every 12 hours initially, but then if necessary, it should be increased to a max of 32 milligrams in divided doses every 12 hours. If you're giving regular tablets to a child from 2 to 6 years old, it should be a zero point 0.1 to 0.2 milligram per kilogram tablet 3 times daily. So you'll have to know how much the child weighs and then do the dosage calculation of what milligram that child should get. If they're between 6 to 12 years old, they should be getting a 2 milligram tablet 3 to 4 times daily. If they are over the 12 years old, then they should be getting the same as an adult. If it's an extended dose tablet, then under the age of 6 years or over the age of 6 years old, it should be 0.3 to 0.6 milligram per kilogram tablet divided twice daily. So that's a Q12. If they're over the age of 12, it's the same as adult. And if they're in between the ages of 6 and 12, they should be getting a 4 milligram tablet by mouth twice a day. So it's Q12 or Q2 initially, but then if they need it, you can increase the dose to 8 milligrams a dose like twice a day. Before taking any of these medications, you need to make sure to tell your doctor if you have any of these following health conditions because they may cause reactions with the drug. If you have an allergy to milk, proteins, or history, if you have diabetes, heart or blood vessel diseases like coronary insufficiency, heart rhythm problems like arrhythmia, hypertension, which is high blood pressure, hyperthyroidism, which is an overactive thyroid gland, hypokalemia, which is a low level of potassium in your blood, ketoacidosis, which is a high ketone level in your blood. If you have a history or have had seizures, it may make your condition worse. And if you have kidney disease, you should use albuterol with caution because it may make for slower removal of the meds from the body, therefore increasing side effects.
Combining these medications with albuterol is not usually recommended, but may be necessary in some cases. Combining with this medication may increase the risk of side effects.
Some of the adverse effects that you may get with this medication is muscle tremor, excessive cardiac and CNS stimulation, which includes angina, chest pain, tachycardia, which is fast heart rate, palpitations, agitation, anxiety, insomnia, which is not being able to sleep, seizures, and tremors. Some special instructions for this medication is to keep it in the box it comes in or the foil pouch it comes in until you're ready to use it. Store it at room temperature and away from heat or direct light. Definitely don't freeze it, especially if it's in a little canister, and don't poke holes in it because it'll probably blow up. After use of your inhaler, rinse your mouth out with water, and you need a doctor's order to get this medication.
When you are using an inhaler, what should you do? Shake well, take out the canister, poke holes in the canister to make it faster. If you chose A, shake well, you were correct. I can get this medication over the counter without a prescription. True or false? If you picked false, you are correct. What does this treat? Anxiety, liver failure, or bronchoconstriction? If you answered bronchoconstriction, you are correct. Thank you for watching my video, and I hope you learned something.